Okay, it's a little after 2 o'clock. Welcome to Virtual Face-to-Face with President Bruce Jarrell. I'm Alex Lukowski, Executive Director of Media Relations. As far as we can tell, for as long as humans have gathered together, the plant Cannabis sativa has played various roles in our culture. Seeds have been used for oil, the stalks for fibers and cloth and rope, and of course the leaves and flowers for recreational and sometimes spiritual intoxication. Well, we're not here today to talk about recreational drug use or growing marijuana or anything like that. Our focus today is medical cannabis. The psychoactive component of the cannabis, known as THC, is just one of hundreds of compounds found in the plant, and many of them are turning out to have some significant medical uses. 36 states in Washington, D.C. and some of the territories allow the medical use of cannabis, and the industry is growing at an incredible pace. It's projected to top between $50 and $80 billion a year within 6 years. For example, Missouri opened up its first dispensary less than a year ago. It now has 140, and the industry there employs 5,000 people. Last week, South Dakota, the legislature there killed proposed limits on medical marijuana, sparking predictions that that state will quickly become a competitive force in the industry. And a day earlier, Alabama hired its first medical cannabis commission director and plans to begin cultivation next year. Now, here at home, the Maryland Medical Cannabis Commission has been operational for about 5 years. By the end of 2020, the state had more than 123,000 certified patients being treated by about 7,800 registered caregivers. Now, last month alone, dispensary sales exceeded $45 million. And the reason for such big business is a big need. Medical cannabis is used to treat chronic pain, to ease nausea caused by chemotherapy, to improve the appetite of people with HIV/AIDS, to calm the muscle spasms of MS patients, and much more. A lot of Americans fit into at least one of those categories. For instance, the NIH estimates about 40% of adults in America experience some kind of chronic pain, and about 20 million of those live with what's called high-impact chronic pain. And why is medical cannabis the answer for so many Americans? Well, I'm going to let the doctors answer that, but they're probably going to tell you that we haven't done enough research yet to really answer that question completely. But the answers lie in those 500 or so chemical compounds found in the plant that I mentioned a few moments ago. Of course, the medical part of the medical cannabis issue is only one part of the complexity in the equation. The laws and regulations surrounding cannabis, marijuana, is something of a Gordian knot. I mentioned that 36 states have legalized medical cannabis. 18 states have legalized all forms of marijuana, and 2 more have decriminalized it. But the federal government still lists cannabis as a Schedule I drug, meaning that it has, under the definition, no currently accepted medical use and a high potential for abuse. And that puts marijuana in the same class of drugs as LSD and ecstasy and a lot of other things. It also means that possession could, in theory at least, get you some jail time. Now, that disconnect between the growing acceptance of medical cannabis and the legal complications posed by recreational cannabis may be due in part to a lack of understanding of the science of medical cannabis and its therapeutic use. And that's why 2 years ago, the University of Maryland School of Pharmacy launched the nation's first graduate degree program in medical cannabis science. The Master of Science in Medical Cannabis Science and Therapeutics provides students with the knowledge and skills needed to support patients and the medical cannabis industry, add to existing research in the field, and develop well-informed medical cannabis policy. So it serves a lot of different functions. The 2-year, mostly online program is based at the universities at Shady Grove and Rockville, and is designed for any individual who has completed an undergraduate degree and is interested in pursuing a career in the medical cannabis industry. And as the school will gladly tell you, the program has been a big, big hit. The first class of 132 students graduated in the spring of this year. The third class met for the first time a couple of weeks ago. It included 244 students aged 20 to 73 from all over the U.S., Canada, the UAE, and Costa Rica. And all of them were asked one very important question by one of our guests about the degree that they've begun to pursue. What are you going to do with it? And as I think you're about to hear, there are countless answers to that. Our guests today are Program Director and Professor, Dr. Leah Sera, and fellow professor in the program, Dr. Andy Coop. Quick word to the audience, the program is being recorded and will be posted on the UMB homepage and on Facebook. Later in the program, you'll have a chance to ask questions. I hope you do. That's what we're here for. Please write them in the chat area. When it's your turn, we'll turn on your mic for you. All you have to do is speak up. If you'd prefer to remain anonymous, that's okay too. Just let me know. Now, please welcome your host, UMB President, Dr. Bruce Jarrell.
Thank you, Alex. It's a great pleasure to be here and again to welcome our crowd. We have two special guests today, Dr. Coop and Dr. Sera, both out of the School of Pharmacy. And I think you heard that this has been a School of Pharmacy program from the beginning, and we're very proud of its success. There's a lot to learn about this particular program. The hardest part I've had is to learn to remember to always put the word medical in front of cannabis. So we're talking about medical cannabis science here, and let's keep that straight for this discussion. Maybe if I could, I'd like to start out by asking both Dr. Coop and Dr. Sera if you would just spend a couple of minutes talking about the program, what it seeks to accomplish, what it avoids, and what your role is in the program. Dr. Sera, maybe I'll start out with you.
Sure, thank you, and thanks for having me on. I'm excited to be here and talk about the program. It's been quite a journey, and it's been a very exciting last couple of years. The program really is the brainchild of our dean at the pharmacy school, Dr. Natalie Eddington. And I first heard about the program when she announced the intent to create it at the end of 2017. I really was hoping to be involved and asked my department chair to put in a good word for me to the dean. Maybe I could teach a course. After sharing some of my ideas, she suggested that I take the lead on developing the proposal and the curriculum, which I gladly did. And we developed this curriculum over really over the first half of 2018, and then brought the proposal to the USM Board of Regents, which Dr. Jarrell, you went with me to propose that, and then also to the Maryland Higher Education Commission. Luckily, when it was approved, we then had several months to finish implementing and developing the program and bringing on students. We had a really amazing response. I think in 6 weeks, we had over 500 applications for the program. And then we launched it in August of 2019. And the reason for the program, as Alex said in the beginning, it's a rapidly expanding industry, and a lot of educational programs, not only in healthcare but in other areas, haven't really included topics on medical cannabis or on the endocannabinoid system or on these related topics. And we really felt that this was a knowledge gap that we could address through a formal education program here at the School of Pharmacy. It covers, it's very broad curriculum. We do, of course, cover the basic science of the cannabis plant, pharmacology, pharmaceutics, so formulation of medications containing cannabis, the chemistry, the evidence-based medicine, what we know about why cannabis works for different conditions, and of course the policy as well. We don't teach any business related topics, so how to run a cannabis business, and we don't have any hands-on interaction with the plant itself. And I'm the program director, and then I'll turn it over to Dr. Coop if you want to kind of take it from there and talk about our experience with the program and our students.
Dr. Coop?
Certainly. Thank you, President Jarrell. Thank you, Dr. Sera. I'm also honored to be here. This last 2.5 years, Leah, is it? How long it's been now? 2.5 years has been an incredible journey. To be involved with a program like this, our initial cohort of students were true pioneers, trailblazers. To sign up for the first medical science, MCST program in the country, they were pioneers. And as was said, I think, Alex, in the introduction, the diversity in experience of the students, 130 something in the first year, the 240 something this year. We do not say that the bachelor's needs to be in a science. So one part of my job, I'm a basic scientist, is to be involved in all the basic science courses. And one of the biggest challenges, and rewarding as well, Leah, right, is we have individuals who are PhD scientists like me. We have physicians like you, President Jarrell. We have folks who got a bachelor's in music. We have lawyers. We have nurses, we have nurse practitioners, and we have business people. So the diversity of experience is incredible. Now, that's wonderful for the future of the profession. But it's a challenge to teach such a diverse set of students. And this is where we came up with a vision very early on, that what we teach would be accessible to all, but valuable for everyone. And that is a vision that we really focus on ensuring that it's accessible to all. And seriously, I'm not talking out of turn when I say that some of the students, because although it's a primarily online program, it's not online program. We have symposia, and I'll hand back to you to talk about these. We have symposia at the Shady Grove campus, so we actually see the students. And they walk up to us and say, I'm scared of science. So having someone scared of science is not conducive to learning. So we really work on ensuring that it's accessible to those students. And that is a challenge, but it's also rewarding. But at the same time, we need to make sure that it's valuable by offering additional optional advanced reading to the others. So that has been the challenge. And I could explain how we did this, but that has been challenged and it's been rewarding.
Thank you, Dr. Coop. Both of you are interacting with these students, and I know we've had some discussion about what the students will do with these degrees. Please give us your own take on that. Is it just a thirst for knowledge, or do you think they want to have a business, or what is it that's driving them? What do you think? Dr. Sera?
I think that our students, because they come from so many different backgrounds, as Dr. Coop said, we have students who are coming from a background of, either being a patient themselves or knowing patients and really wanting to advocate for patients to be able to use medical cannabis. We have attorneys, we have clinicians who want to bring what they learn back into their own practice, or maybe start a new clinical practice. And we have entrepreneurs, of course, who are hoping to either break into the industry as it exists, or to start something new, to start their own business. And because they come in from all of these different backgrounds, we know that going back out, they're going to be using this degree in a lot of different ways. And we do have some students that probably come in because they thirst for knowledge, but we really hope that students have some kind of idea of how they'll use this degree when they come into the program, and even though, of course, that may change over the course of the 2 years.
Dr. Coop, anything to add to that?
I would say that one thing that comes over loud and clear from interacting with the students is the want to advocate, that advocacy. So the education that we're providing them in all the different areas of cannabis science, they want to use that to educate our elected representatives. So they really want to use this for advocacy.
So you're a research scientist, Dr. Coop, as you described yourself. And all of us know that in the history of medicine, a lot of medications came from plant-derived processes. Certainly the Amazon has a rich history of that. Tell us a little bit about this plant, the 400 or 500 compounds, and sort of some generalizations on scientifically, research-wise, what do you expect to learn from the basic chemistry of these plants?
So cannabis and its various strains has, as I think Alex said, 500. I think it's more than that now. The number of components within cannabis is increasing significantly every time we look for additional components. However, the components that are generally recognized as being the major ones are THC, delta-9 THC, tetrahydrocannabinol, and CBD, cannabidiol. Now, delta-9 THC, which I'll call THC, is the agent that is responsible for the high, for most of the neuroactive effects. Strains that have a lot less THC, below 0.3%, are hemp. And with the Farm Bill really changed the laws around hemp and what's left in hemp, which would be CBD cannabidiol. Now, one of the biggest issues with the science is that because it being a Schedule 1 substance, the science has, one, not been consistently applied in terms of clinical trials, and two, the material that's been used in such trials is inconsistent. So it's inconsistent material used inconsistently. And this is why, if we look at the literature, it is full of contradictions. We do have animal preclinical data, which is where we can show that THC is indeed an analgesic and it has all its other medical effects. CBD does appear to be an anti-inflammatory. And the targets within ourselves are well known, and the individual components have been studied. One of the biggest things, though, and I don't want to go on too long, is what's called the entourage effect. Now, the entourage effect is where all the different components, the cannabinoids, as I said, plus the terpenes, and the terpenes are the agents that give the distinctive smell to cannabis, all interact and cause effects from them all interacting like an orchestra rather than one individual. And we still need the science to further study this effects.
That will be hard to sort out, I have no doubt.
It is. It is.
So, do you think you're going to advance this course to a doctorate in cannabis, the science of medical cannabis, or do you think it's going to stay a master's for some time?
I think that we have a lot of ideas about how the program might evolve, and different things that we'd like to do with the program. And we certainly know the importance of research. I think that the ways in which we can expand the program and add different activities or add, another level of education to what we currently have at the master's is going to depend a lot on what happens with at the federal level in terms of the regulation of cannabis and the ease of, research and those things. But certainly, Dr. Coop and I have had a lot of conversations about the things that we'd like to do, to provide more experiences and different experiences and expand our program in the future.
I just checked an hour or two ago. The federal government has still not taken any action to make it legal for these purposes. And so for those of you in the audience, we're still not able to do research on these chemicals derived from the medical plant marijuana until the federal Congress takes an action here to make it safe for us to do so. I want to get to one or two other questions quickly, and then I know we've got some questions from the audience, and I do want to urge all of you to get your questions in. There were a couple of things that were brought up about cannabis that are questions to be asked, whether they're misconceptions or proper conceptions. And let me say them in order. Is it addictive? Is it necessarily intoxicating? I'm not sure what intoxicating means here. Will it cause brain or lung damage? Can it cause psychosis or precipitate psychosis or bipolar disease? Any data to answer any of those?
Those are definitely a lot of questions. The data on the associations between cannabis use and different mental health issues, things like addiction and psychosis, are also a little bit hard to parse because the studies, as Dr. Coop mentioned, the studies are studies all related to cannabis are variable in their methodology, which makes them hard to compare. And particularly epidemiological studies, there's a lot of confounders, things like other drugs of abuse, and so there does, cannabis use disorder, it does exist. So that is a syndrome that does exist. Some estimates put the incidence of cannabis use disorder around 9 or 10%. Those estimates don't differentiate individuals who use cannabis for medical purposes and in individuals that use cannabis for non-medical purposes. So, when we talk about use of medical cannabis, it's hard to apply the data to a population of patients who are using cannabis as medicine. There's also, likewise, data that associates cannabis with psychosis and, or schizophrenia or other mental health conditions. There are associations. Some of this may be related to the increasing potency and levels of THC that we do see, over the last several years, that may be associated with episodes of psychosis, and the individuals who have a genetic predisposition may also be at higher risk. I think it's important to know that, just like any other medication, cannabis, although it's a plant, although it's considered a natural medicine, is not without risk. And in our program, we do think it's important to provide that balance. We have an entire course that is dedicated to teaching our students about the potential negative effects of cannabis. And so it's something that is like all aspects of cannabis, we're still really in the process of clarifying what we know, because the cannabis plant is very complex and individuals are very complex, and how they respond to cannabis is very complex. So I think that there's a lot of questions, but our job here in our program, we feel, is to provide our students with balanced education regarding the potential benefits of cannabis as medicine and the potential risks.
Thank you, Dr. Sera. Dr. Coop, anything to add there?
All I would say is one thing from my side as a basic scientist is I do talk also about the synthetic illicits like the K2 and the spice. And they're actually, although they work through the same mechanisms as, say, THC, those actually do have significant negative consequences. Hypothermia can be lethal with those. And we do explain the difference between those and THC. Although they do have very similar mechanisms of action, there are differences.
Thanks. So Alex, I know you got some burning questions, so why don't we get to them?
I see. I was going to swear off the puns for this one in the name of science, and I see. I'm the only one that's taken that pledge. We do have some burning questions. I'm going to bring in Andy Eckert. I don't know whether to call you a journalist, a communications professional, a podcaster, but I think you know him. Andy, go ahead and ask your question.
I seem to have met almost all of you. I was wondering if other schools from other states have reached out now that you've had a successful class go 2 years through to ask how you set this program up. Any advice if they're looking to copy the program or build off of that?
I'll go. Hi, Andy. Andy's also a first-year student in our program, so I don't know that I've had requests for advice on how to develop a medical cannabis program, but we have seen some other programs, not exactly like ours, kind of pop up in the last 2 years, but we have seen other educational programs, whether they're graduate certificates or tracks within graduate programs that focus on cannabis. So I do know that this is an expanding field in and of itself of cannabis education or medical cannabis education.
I've had a few of my friends in my field I run around in reach out to me, and as soon as I mentioned that our philosophy of being the diverse class, open to everyone with diverse backgrounds, the individuals I've spoken to cower away from that because of the challenge and the rewarding aspect of teaching such a diverse class. So no one has created a program like ours because of these challenges that we enjoy taking on.
Gotcha. Alex?
Well, you talk about the challenges and also the challenges in research, given that we're talking about something that is a Schedule I compound. The anonymous question comes in: given the difficulties, are there any current research studies with human participants? Is anyone doing that kind of research?
Not at our school, to my knowledge. Not at the School of Pharmacy. Certainly, research is being done. There's a lot of research that's being done. There are a lot of challenges to doing, particularly clinical research in the United States because of the Schedule I status of cannabis. You know, there are regulatory challenges, there are supply challenges, you know, but research is being done, you know, for sure, you know, to try and elucidate these clinical effects of medical cannabis.
Because there is one approved cannabis growing facility for the NIH, and it's in Ole Miss, and I've seen it, and it's got barbed wire and gun towers and everything. But that facility does grow cannabis for studies in the United States. And one of the advantages of being virtual is we were able to have speakers at our virtual symposia, and we had individuals who are actually involved with clinical research with cannabis at these symposia. So yes.
I think one of the reasons that the questioner was asking about human studies was because people often talk about, you know, it's the effects of drugs. It's also dosage. I mean, how do you develop things like that without human studies?
Well, when you think about applying what research we have in medical cannabis to, you know, clinical practice, it's very challenging in compared to what we're familiar with other medications, you know, and that's for a lot of reasons. You know, one is because a lot of the, you know, there is a variety of formulations, concentrations of medical cannabis, and that is different in every state. And so there's a lack of uniformity, and some of the studies that have been done with compounds, you know, that aren't even available for research in the U.S. So there's a lot of extrapolation that has to occur from the clinical studies that have been done to what one might apply to someone in, you know, who's walking into a dispensary, you know, who's going to go into a dispensary, you know, Maryland, for instance, to get an actual medication. It's unlikely that that formulation is going to have been studied. So that's just one of the challenges that's kind of inherent in this space.
Okay, Alex?
All right, well, so one of the people who was there, for the first class, along with me, is a former colleague of mine, Patricia Fanning. I'm going to bring her in for this question. Patricia, did I get you in?
Yes, here I am. I'm delighted to see the first class has graduated. And my question is, how are they putting their new MS degrees to use? And are they serving as role models or mentors to the 2023 class? I believe it takes 2 years. So I'm curious how they're all faring in their journeys as trailblazers.
Thanks, Patricia. It's really great to hear from you. And Patricia was just so incredibly helpful when we were launching this program. So thank you so much. The students are using their degree in a lot of different ways. So we have students who were clinicians before they came in, and they've come back and brought, you know, knowledge back to either have a cannabis specific practice or to do consulting. We have students who have started, you know, consulting businesses, or who have gone into, you know, the more traditional cannabis, you know, medical cannabis industry and working in dispensaries or quality control or processing facilities. We have students who've gone on to do further education. We actually have one of our students is pursuing a PhD at Ole Miss, which, Dr. Coop mentioned. And we have another student that I know of who is pursuing a degree in psychology. So the students are doing a lot of different things. And yes, to answer your question about whether they've stayed involved, they definitely have. We've had students, come back to be a part of our symposia that, we just had. The first symposium for our first year students was last Friday. And so we had some of our graduates come back to participate in that. And we have had students mentor, our graduates have mentored other students to, provide interviews for assignments and things like that. So I really do feel like we're creating a really special community in this program.
And I just want to add one thing we added last year was networking and career opportunity panels. And we are reaching out to our alumni to help with those for future. Obviously, we didn't have alumni last year to be involved, but in future we will, to build that network, because the networking at the symposia is actually amazing. It's something students really value.
Great, thank you. Alex, how about another one?
All right, let's bring in Margaret Malero. This is a great question that she's got, given the fact that this industry is just exploding, right? I mean, it's amazing. Margaret, go ahead, and what's your question?
So I think I heard partial answer already, but have you had inquiries from industry employers or stakeholders regarding graduates for potential recruitment or placement or positions? Have there been actual industry professionals seeking the graduates from the program?
Yes, and actually last year we held a virtual, of course, career fair in which we had, about 15 companies who were hoping to, specifically recruit our students. And I think that in last week when we spoke, Dr. Coop and I at the Cannabis Science Conference in Baltimore, after our talk, someone from, one of the local processing facilities got up, because we had a lot of our students in the audience, and said, "We're hiring, so please come and see me." So I think that there is a lot of interest in, in our students in the industry. And I know that a lot of our students do work in, in the medical cannabis industry, kind of the traditional industry.
Dr. Sera, what about big pharmaceutical? Are they going after these students as well? Do they have an interest in medical cannabis?
I think that until, as we said, until federal regulations change, I don't know that there's going to be as much interest from major pharmaceutical industry, as there is in, more small business, because the laws vary from state to state. We may see that change, in the future. But right now, I don't think I've heard, I can't, think that I've heard a lot of interest from major pharmaceutical industry in regards to our program or students.
My
Dr.
prediction, President Jarrell, is going to go the way of electronic cigarettes, is that it will start with smaller companies and then eventually the large business will buy them out.
Yeah. For the audience, one of the issues about it being a scheduled drug, beside the fact that it's illegal to prescribe or to use, this university gets a huge amount of support from the federal government, both in research grants and maybe just as important or more importantly, all of our educational programs, the scholarships, et cetera, that come from the federal government falls under this same category. And if you were to violate the rules relative to cannabis, you would threaten here at least $130 million worth of scholarships and loans, student loan program that our students get. So that would be a really big price to pay. And so for now, we clearly take the point of view, none of that kind of research can be done here. It's unfortunate because we don't even have a breathalyzer test, do we? We don't even know if somebody's driving down the road and gets in an accident where they use the marijuana or not. When's that going to happen, by the way, that we're going to get that test? Not until we do research, right?
There's a lot of research going on for a roadside test for marijuana. That is a huge area. If someone could create one, you'd make a fortune overnight. but there's a lot of research going into that at the moment. Yes.
Yeah, I can't tell you which state, but just in the last day or two, a state legislator has proposed a law that would sort of, allow someone who's on medical cannabis to be affected when they drive. In other words, they couldn't be arrested for being impaired if they're using medical cannabis. I think that sounds like it confuses things, but it's an issue. You talked about, I have an anonymous question here that sort of dovetails on what you were talking about. You were talking about big business and then small business, but really, what is the business model? So this person writes, if federal laws are changed, do you see the industry following more of the pharma bio life sciences model or the vitamin supplements model as far as interacting with the FDA and other regulatory agencies?
That's a great question. And I don't have a very solid answer for it. I think it's really hard to predict, and it'll depend on, what route any changes in federal regulations take. Do they, would cannabis be rescheduled to something that is lower, like a Schedule 2, or would it be removed from the schedule of controlled substances altogether? And I think that would, depending on what decision is made, ultimately that would have big effect on how cannabis is treated as a commodity, a product, a medication moving forward.
It's just mind-boggling that you could go from a Schedule 1 drug to no regulation or very little regulation. That just is nuts, isn't it? Andy, you were going to say something?
All I was going to say is we can't forget there is a cannabinoid clinically approved,
Yes.
actually. So CBD is currently approved for certain specific conditions. So in terms to answer your question, in terms of individual components like that, I would see big pharma, like they already have, getting involved. In terms of the mixtures, in terms of like the entourage effect, as I mentioned, that would be a lot harder and to keep consistent. So maybe that would be, I think actually what would happen is a two-pronged attack to this answer.
Great. Alex, next.
I'm going to bring in Becky Sera. You know who she is. She needs no introduction.
We
from the
know
School
her.
of Pharmacy. Becky, go ahead.
Hi, everybody. Dr. Jarrell, I'm curious about your thoughts on this program as the president of UMB and how you see it, fitting in the portfolio of other academic programs. It's unique, so what do you think about it?
Well, Becky, the way I would answer you is maybe not the way you intended. I think this is a great example of a school of pharmacy, being very creative and developing more online resources, in this case, a course, but it could have been more than that, and having the capability to respond to a market need in a very facile and rapid manner. So to me, it's a poster child of what we in education should be thinking about. The governor makes a point all along to say he's interested in more workforce development. And I think we as a university have to take that very seriously and say, okay, what are the workforce needs? What are the industry needs? And how are we addressing them? So to me, this is a very creative approach to that. And I think I would say not just to Dr. Coop and Dr. Sera, but to everybody on the line, okay, what's the next one? And what's the next one? And how do we as a university provide these needs? This issue is going to come up with, well, it already came up today in nursing. Okay, you all know there's a nursing shortage. Okay, so what are we as a university going to do to respond to that? Now, that won't be an online only course, that's for sure. But the whole point here is to respond to the needs of people in the United States who need jobs and need to go to work. So I don't know whether, Becky, that gets to your question or not, but to me, that's what's been so wonderful about this course. Becky, does that get it?
Oh, let me open her back up. Becky?
Yes, it does. No, thank you. I appreciate that. And you recorded that, right?
Don't tell Dr. Eddington I said that.
All right, that raises a question, though. A couple of questions that people listening to this conversation have asked. First, on the faculty front, is it hard to recruit faculty for this program? I mean, do people have the expertise that you need, that you want to be able to effectively teach in this area?
It hasn't been hard to recruit faculty for this program at all. We have probably more interest in people teaching in this program than we than we logistically can involve in this program. There are many industry professionals and interested individuals that want to teach in this program, and we do have several industry experts that have helped us to develop courses, that help to teach our courses, and it's been one of the greatest parts of the program, incorporating so many different experiences.
And on the other end, someone writes, tell me about the application process and what would make a strong application. But there's a good point here, but who are these students when you're looking at them? What are you looking for? I remember at the event the other day that Andy said, that he read a lot of the essays, most of them, I think he said, which is amazing. But what were you looking for when you were doing that? Who's the best student?
Yep, Andy,
I'll
take
this
this?
one. Yeah, thanks, Dr. Sera. So what we're looking for is not necessarily a perfect GPA. Many individuals who are entrepreneurial like this may not have a perfect GPA. That's fine. We're looking for a passion. We're looking for a vision. How you are going to use the degree. The question we had earlier, how are they going to use the degree? That's what we're looking for in the essay. If an essay said, I like smoking cannabis and I want to join your program to learn about it, there's a chance that's probably not the strongest essay ever. We're looking for essays, by the way, that happens. But we're looking for essays that have a vision, but we're also looking for a diverse class. And when I say diverse, I mean in its many constituencies. We're looking for a range of individuals in this class so that they can interact and teach and interact with each other from a range of different disciplines. So it really is a vision, but it's also looking for a nice holistic approach to the class.
Dr. Sera, one thing that on the previous question that perhaps you might also address, getting to Becky's question, I think you had significant interaction with the Center for Teaching and Learning to set this up. Does that sound right? Tell people what that is and how that helped you get this up and running quickly.
The Faculty Center for Teaching and Learning is a group of instructional design professionals that their job is to assist faculty with designing and developing and implementing courses. And they were absolutely instrumental in helping us get the program off the ground in the abbreviated amount of time that we had to do it back in 2019, in terms of working with different faculty to consider, what are the course objectives, and really work through the development of each course in a really structured way, to make sure that the students, the faculty are getting across the messages they need to get across in the course, and the students are also having a valuable experience.
Alex, other?
Yeah, I don't know if this questioner has a specific goal in mind, but he's asking, is there anything that you're not focusing on now in this program, that now that you've been through a couple of classes, the industry has changed, you see the needs, you see what people are doing, are there other areas that you would like to focus on?
Yes, one of the areas I think that Andy mentioned previously that our students are so interested in is advocacy. And so we're looking to expand our range of electives to include more coursework on public health and patient advocacy. That's, one area that, again, is something that, because of getting to know our students and what their needs are, we're responding to that.
And as things change, we would love to be able to incorporate things that we currently can't. We can't include finances. We can't include growing. There's many things we cannot include at the moment, but as the laws in the country change, we would adapt. But at the moment, obviously, we're not allowed to. We don't. But as laws adapt, as laws change, we would adapt to the changing environment.
A little while ago, another questioner asked about, is it your hope that some of your students will go out and in this sort of advocacy and will help to undo some of the stigma that surrounds cannabis, especially we're talking about medical cannabis here?
Absolutely. One of the overall goals of our program is that we want our students to go to continue our work of education once they graduate, and to the point where we actually teach some instructional design within the program and have them practice working with some external group to develop educational materials, because we think that educating healthcare professionals, legislators, communities, patients about medical cannabis is going to be one of the key ways that we reduce the stigma around using this plant as medicine.
I have a feeling one of the students you passed over earlier on is asking this question, but did any of the overflow applicants? Because I remember you had 500 or something like that. You had a huge number of applicants the first time around. Did any of them come back? Did they reapply? Or any of your students now these overflow applicants?
Absolutely. And in the first year, we kind of rolled over a lot of the applications into the second year because we had a very short period of time, in which to fill a class. And so a lot of the applicants, as you said, that were overflow, we then reviewed for the second cohort. And many of them, were accepted into the second cohort of the program.
Thank you, Alex.
Okay. There are some skeptics. So one skeptical question that we have here: are people abusing the medical cannabis registration just to get access to legal marijuana? And I mentioned that, and this was the end of last year, because they don't have the numbers for this year, but the end of last year, we had 123,000 registered, card carrying medical cannabis users. That's a lot of people.
I think it's hard to say yes or no. I think that there's a gateway mechanism whereby, a patient in Maryland anyway can't just go and apply for, a registration card and then, through the Maryland Medical Cannabis Commission and go to a dispensary. They have to go and see a physician or provider, so, physician or nurse practitioner, et cetera, who themselves is registered with the commission, and that provider has to certify that the patient has a qualifying condition. So, there are, some gateway mechanisms to make sure that the patients who, are being registered or approved to obtain medical cannabis do get it. Are there, likely some blurred lines, that, some people are using for both reasons, probably, but I think it's impossible to, right now to say specific numbers.
Dr. Sera, sort of related to that, is there a lower age limit? And if I'm below that age limit, this is not accessible to me, medical cannabis?
In Maryland, children can obtain medical cannabis, but need to have an adult caregiver who's also registered with the commission that would go and actually obtain medical cannabis on their behalf. But again, that differs, all of these regulations differ from state to state.
But my 10-year-old kid, if I had one, could get access to this if the need were validated.
Yes, in Maryland, yes. I don't know if there's a lower age limit, but I know that children, if they have a registered caregiver and a qualifying condition, can have access in Maryland to medical cannabis.
Okay, Alex?
Well, we were talking about a moment ago about the relationship between, medical cannabis and recreational cannabis. I'm going to bring in Jean Yang, who has an interesting question about other drugs that are abused and how they're affected. Jean, go ahead.
Hi, sorry. I'm just curious, because I haven't actually done much research in this area. But I have heard of friends, parents using medical cannabis for pain management. So I was just curious as to, if other drug use that, handles chronic pain, if we've seen a decrease in numbers with the rise of medical cannabis use.
Yeah,
Dr. Seth,
go ahead. Oh, go ahead, Andy.
I was going to say that is an incredibly important question that in the fields I run around in, which is all drugs that could be abused, is asked all the time. And without getting into all the details, the results are mixed. Some studies have shown that opioid use has gone way down, and other studies have shown no, it hasn't. So the results are mixed. And part of that is due to the lack of consistency, lack of the studies. We're not sure what's going on, but the studies that are out there are mixed, is at best. Dr. Sera?
Agreed.
Yeah, I was going to add because when I think about other people that I've worked with that have chronic pain and aren't able to handle it, they do tend to resort to other substance or alcohol use. And that those rates of trying to manage chronic pain and alcohol use goes hand in hand. And I guess that would be very hard to track or measure in terms of comparing that with cannabis use.
It is, but yeah, as I said, the studies out there, it partly is we need consistent material, consistent studies, but the results are just inconsistent at the moment. But I can't really say more than that. People are actively studying it because they would like to see that opioid use has gone down. Would like many individuals would like to see this, and they are in some cases, but not in others.
That sort of echoes is a slightly different take on another one of these skeptical questions. Someone's asking about research that, the research seems also to be conflicting, right? On one hand, this person writes, I see studies that say that medical marijuana is very effective at helping people cope with chronic pain, and other studies that say, well, it really doesn't do that much. How do we trust the research?
And I think the research that we're hoping for, one of the studies that there's a very exhaustive systematic review published in 2017, and I think updated in 2019. That was published by the National Academies of Science, Engineering, and Medicine. And they made a lot of recommendations based on the evidence that is out there. And the evidence is of varying quality. But I think applying the same concepts of evidence-based medicine, what is the hierarchy of evidence that we find valuable? Okay, are there systematic reviews? No. Are there randomized control trials? If yes, how many, and are they comparable? And then, if not, what, observational data is available. And I think that you have to really look at the data with a very critical eye. And we teach in our program, we teach our students about evidence-based medicine. We teach them how to critically evaluate the medical literature because it is such a challenging area of evidence of medical literature to navigate. So it's really just about knowing how to, appraise, individual studies. And, hopefully as we, get more data and as we're able to do more research, then we'll have more answers.
Alex, we got time for maybe one or two more questions.
I have one serious question and one that's I'm going to save till the end. It's not serious. It'll be very quick. The serious question is, Andy, you brought up CBD, and this person writes, I see a lot of advertisements for CBD. It's marketed as like a wonder drug. All these celebrities use it. Is it really is it really all that? Because you just said, well, for very limited purposes, it's useful. What's the truth about CBD?
Oof. So, what you've not mentioned is it's really hot in veterinary studies at the moment. It's really being pushed for veterinary studies. Part of the issue is there's one been approved, but it's been approved epilepsy. It's not been approved for pain. So you've got to remember that. And the FDA is always sending letters to these companies saying, hey, stop marketing it for that reason. So the FDA is always sending letters to these companies and they're trying it on. They're going too far. The studies are, actually with pure CBD, there is significant studies that it does indeed impact inflammation. There are significant studies that it does is an anti-inflammatory. That's pretty much clear. After that, the effects on epilepsy, definitely, but otherwise, I think the companies are pushing it too far, which is why the FDA keep telling them to rein it back in.
Now, that National Academy study, really, it was a long study and it covered a lot of these different topics. It's worth looking at if you haven't seen it. Alex?
All right. Well, finally, we're trying to keep this serious today because it is a serious topic, obviously. But, we all have families, and someone writes, when you go home, do either of you get any good-natured ribbing from family members? Do they call you Dr. Feelgood, or do they, how do people react when you tell them, yes, I teach all about cannabis?
My parents are very proud of me.
Oh, I know, I'm sure they are, but
and all the work that I've done educating about medical cannabis.
okay.
I've been working with drugs of abuse for 30 years. My mother can't keep up which drug I'm studying at the moment, so I should just...
Okay.
That's
like,
good.
you doing cocaine this week, or what are you doing this week?
Yeah. So Leah, you haven't got invited to all the high schools to talk about this yet?
Well, when I was in pharmacy school, I did go to high schools to talk about drugs of abuse. So I've been actually working in this area since I was a student here at the University of Maryland. So I enjoy talking to students and to community groups as well. Any way to educate.
Well, we're about out of time. I want to thank the two of you for a most stimulating discussion. It was really kind of a good topic. And I think we'll want you back in a year or two to see when the federal laws change, and I hope they will, that we'll then see how that changes the perspective of this course and what you teach and where we're headed with it. So I really look forward to that. I want to thank you very much for appearing. Alex, as usual, you're a great host. Thank you again. And for the audience, thank you for participating in this too. So for now, thank you all, and see you next time.
Care.
Thank you.
Thank you.